And now I would like to invite Dr. Claire Pomeroy to come to the podium to present the Gustav O. Lienhard Award. Claire.
Thank you, Victor. Each year, the IOM recognizes innovative, creative, and pioneering efforts toward improving personal health services in the United States with the Gustav O. Lienhard Award. Through a generous endowment, the Robert Wood Johnson Foundation established the award in 1986, named in honor of the first chairman of the Foundation's Board of Trustees. This is really fun. I am very pleased to announce that the recipient of this year's award is Linda H. Aiken, the Claire M. Fagan Leadership Professor of Nursing, Professor of Sociology, and Director of the Center for Health Outcomes and Policy Research at the University of Pennsylvania. Congratulations, Linda. Now, Linda's going to stand here for a moment while I tell you a little bit about her fantastic work. Dr. Aiken's work to inform and advance health practices and policies related to the nursing workforce has transformed healthcare. Her research has demonstrated how nurses improve the quality of patient care, shown the need for adequate workloads, and the need for a well-educated nursing workforce. She has also led great advances in improving health for an array of at-risk and underserved populations, including those who are homeless, mentally ill, or uninsured. Now, as president of the American Academy of Nursing, Dr. Aiken conducted several studies that led to a revolution in the way that hospitals and other institutions think about and utilize nurses, both in the U.S. and abroad. The studies found that poor work environments led to both harmful consequences for patients and high turnover rates for nurses. Under her leadership, the Academy developed magnet hospitals that became a voluntary accreditation program that recognizes hospitals and other institutions that have exemplary work environments for nurses. Dr. Aiken's research has demonstrated that a better educated workforce is associated with better patient outcomes, catalyzing an industry-wide shift in education and hiring practices for nurses. You know, in the past, there was this perception that experience was more important than education in the nursing field. However, her data, published in 2003, showed that increasing the number of nurses with Bachelor of Science in nursing degrees was associated with a significant decline in patient mortality rates. And really, largely as a result of these insights, the IOM Committee on the Future of Nursing, which you mentioned earlier, Victor, recommended that a minimum of 80% of nurses hold that BSN by 2020. More than 100,000 registered nurses are currently completing their BSN, and that number is increasing every year. So, for her rigorous research demonstrating the importance of nursing care, the importance of workload, and the importance of nursing education and the work environment in achieving safe, effective, patient-centered, and affordable health care, I am delighted to present this year's Gustav O. Lienhard Award to Linda H. Aiken. Congratulations. I would like to invite Dr. Aiken to say a few words.
This is a wonderful honor. I was pleased to be a mentee of Gus Lienhard. I actually worked for him for 10 years. He was tough, he was smart, and he believed in nursing. My fellow members of the Institute of Medicine, the arrival of Ebola in the U.S. has illustrated in stark terms what our research has been showing for 2 decades. That is that many healthcare organizations have poor work environments that undermine the effectiveness of healthcare and put both patients and nurses at risk. 60% of nurses at the hospital bedside lack confidence that management will resolve problems in patient care that nurses identify. 40% of nurses at the hospital bedside say that their work environments are not conducive to safe, effective care. Safe care for both patients and nurses cannot be guaranteed until institutions, all of them, hospitals, home care, nursing homes, ambulatory care, place a higher priority on creating the conditions under which dedicated, qualified clinicians can be effective. And we have the science to prove it. Thank you.
Well, please join me again in congratulating Linda Akins. So Linda, I have the fortune of speaking to the Academy of Nursing Saturday. Were you there? And I wanted to tell people this great recognition of a great nurse who's done so much for our country and globally. So I had to kind of imply about how excited we are in honoring someone today, and here we are, Linda. Thank you so much.